Hi everyone, I'm James and I hope everyone's had a good day today so far. Today I'll be presenting to all of you the topic of intergenerational trauma and how it relates to Indigenous Australian health, as well as how we as clinicians can use specific strategies that can help address barriers to achieving equitable health outcomes amongst the Indigenous Australian communities. Before we begin diving deeper into the topic at hand, I would first like to acknowledge the traditional land in which I present upon. I'm currently presenting on the traditional land of the Darug Nation here in Penrith. I also wish to pay respects to elders, to the past, present and emerging. Just a warning, also this presentation may contain images of Indigenous Australians that have passed. So firstly, I'd like to begin with what is intergenerational trauma. To begin, I'd like to talk about why intergenerational trauma is relevant when working with Indigenous Australian patients. To learn more about this, we firstly must look at the past and dive deeper into the history of the Aboriginal people. We'll be looking at how past colonisation and the stolen generation continue to perpetuate trauma throughout emerging generations. Historically, the Indigenous Australians lived in mobs, inhabiting all areas of Australia. They lived in many nations scattered across the continent, speaking many tongues and practicing diverse customs and traditions, all of which gave each mob a unique and distinct cultural identity. When the first Europeans discovered Australia, they were unaware of these unique and diverse cultures as well as their connection to country. Because of this, colonists began to displace people from their communities. They also enforced speaking English and abandoning many traditions in place of Eurocentric customs, all of which have contributed to a loss of the cultural identity and the loss of trust between the Indigenous and non-Indigenous people. Years later, in 1910 to the 1970s, an assimilation policy came into fruition. Its aim was to separate half-caste children, which are people of mixed Indigenous Australian and non-Indigenous Australian descent, from their Indigenous families and communities so they could assimilate into European society. This led to a loss in trust toward anything affiliated to the government or mainstream society, and has negatively affected their trust towards mainstream clinicians, including us as nurses, which has led to significant disparities in health outcomes because Indigenous people may not want to receive treatment from non-Indigenous people. These are some of the disparities that still exist today. The average life expectancy for Indigenous Australians is on average 8 years lower than the national average, according to the Australian Bureau of Statistics 2023. And according to Al Yemen 2017, 70% of diseases suffered amongst Indigenous Australians are chronic. It's also estimated that 1/3 of the Indigenous community may have experienced intergenerational trauma. Darwin et al. 2023. So what is our role as nursing clinicians? So nurses do play a significant role in Indigenous Australian health in contributing toward closing the gap. We make up the largest health professional group of clinicians with first-hand direct involvement in promoting positive health outcomes. As nurses, our role is in managing patients who may suffer from intergenerational trauma is to ensure we help patients overcome barriers to receiving the life-changing care they need. This includes making sure we can foster genuine relationships that facilitate trust. In doing so, we can effectively deliver effective nursing care for our patients. Our role as nurses also involves ensuring our patients are receiving the best care through the collaboration of other disciplines and delivering trauma-informed care. And now these are some strategies. So finally, for our last topic, we'll be discussing some highly essential and effective strategies we can apply in our nursing practice when delivering care to Indigenous Australian patients who may have experienced intergenerational trauma. So firstly, I begin with trauma-informed care. So when delivering care to patients who may have experienced intergenerational trauma, it is essential as clinicians that we practice trauma-informed care. This can come in many forms, including using neutral language that won't potentially trigger past traumatic memories, being mindful of preferences. For example, female patients may have had negative experiences with males in the past, and perhaps accommodating by ensuring female nurses are made available and recognizing signs of trauma. Being aware of signs such as withdrawal from certain people, being closed off, or visibly looking upset or anxious can help us clinicians take further action to ensure patient-centered care that accommodates to their specific needs. Secondly, fostering a therapeutic relationship. By fostering a therapeutic relationship, we are taking a patient-centered approach. This strategy builds trust in overcoming barriers to receiving healthcare. This strategy involves prioritizing the patient's emotional well-being by aligning our practice with the patient's comfort and preference, ensuring we can build an empowering friendship. And thirdly, collaborating with other Indigenous Australian clinicians. Many Indigenous Australians who have experienced intergenerational trauma may not trust mainstream clinicians. One way we as nurses can overcome this is by collaborating with other nurses who may be of Indigenous descent and other Aboriginal practitioners. This can help overcome a lack of trust. Collaborating with other Indigenous Australians can facilitate fostering a bridge between Indigenous and non-Indigenous clinicians, allowing us to work together to deliver the best care we can and contribute to a better health outcome. Thank you for listening. These are some of the references I've used, and I would just like to conclude this presentation by thanking the traditional custodians of the land for welcoming me to present on their traditional country. Thank you.